the neuropsychiatric symptoms are very important because, in fact, most patients have neuropsychiatric symptoms. They will vary with time, in severity, in quality, but patients who have more neuropsychiatric symptoms, or at least more severe neuropsychiatric symptoms, are quite difficult to handle by caregivers. It will the symptoms increase a lot the burden of caregivers, and they also increase the risk that a patient gets admitted to an institution. So this is not good for the patient, it's not good for the caregiver, it's not good for the family, or even the society as a whole. And so it's very important that we, as much as possible, detect and treat these symptoms. There are lots and lots of symptoms, actually, but we tend to see in earlier stages of the disease, we tend to see apathy. Apathy is seen throughout the disease course, and it's quite a troublesome symptom, as we have no means of treating it effectively. Actually, it's very, very difficult to reverse apathy unless patients respond to anti-dementia drugs. But people, caregivers and families tend to be very, very upset by how patients are apathetic. And then we have a lot of other symptoms. Many patients will have anxiety, depression, agitation, rummaging, sleep disorders, and rarely most patients don't have hallucinations, but some will also present hallucinations, and many of them will also have delusional thoughts, like jealousy. Jealousy is very, very common, and also theft delusions. People tend to think that someone stole them objects, but in fact, what happens most of the time is that they just kept these objects previously somewhere in a drawer, or in their bedrooms, or somewhere else, and they just can't find them, and so they will tell everyone that they have been stolen. Many of these symptoms are manageable with our current therapeutic options, although not as effectively as we would like to. And there is ongoing clinical research with regard to these symptoms, and in order to find new drug approaches that will be able to improve the symptoms. Although many of these symptoms can be improved, and we should try to improve them by using non-pharmacological approaches, such as trying to calm down the patient. There are some psychotherapeutic approaches. Cognitive training in some instances will also help. And there are even some experimental approaches, such as music therapy, aromatherapy. Occupational therapy is also a very nice approach if feasible and if possible. Sometimes it's not. In many instances, it's not, unfortunately.